Hi, I'm Dr. Hani.
I'm Dr. Justin.
And we're from Dental Designs. Today we'll be busting some myths about tooth sensitivity. Your morning glass of orange juice can make your teeth more sensitive.
Now, it's a fact. Orange juice, lemonade, soda, wine, vinegar, tomatoes, and other really highly acidic foods and drinks can actually wear away your tooth enamel and trigger some sort of sensitivity.
That's true. If you use a straw when you sip acidic drinks, it actually minimizes the contact of your teeth from this acidic substance. The other thing that you can do is also balance the acid levels with things like milk or drinking water immediately after drinking anything acidic.
Yeah, I like to drink a lot of milk, so that's great.
Perfect.
Tooth sensitivity is caused by cavities.
This is true, but not all the time. Tooth decay usually causes sensitivity, but you can also get sensitivity without cavities. Generally, sensitivity occurs when the enamel of the tooth gets worn away. So anything that causes the enamel to get worn away, which exposes the dentine, can lead to sensitivity.
Yeah, and that's really quite sensitive, right?
It is really uncomfortable. There is no cure for tooth sensitivity.
So depending on the cause, there are many ways to treat teeth sensitivity. I think the most important thing is proper oral hygiene. So that means brushing your teeth well and sort of not traumatizing the gums. That's the best way to prevent any sort of sensitivity, because if you brush too hard, the gums tend to recede, and that's when you expose the inner layer of your teeth that are often much more sensitive.
That's true, and if you experience sensitivity, you can always schedule a comprehensive checkup with your dentist, and maybe they'll be able to recommend you like a desensitizing toothpaste or an in-office fluoride gel treatment, or any other corrective dental procedures to manage the sensitivity.
Yeah.
Brushing your teeth as often as possible prevents sensitivity.
So brushing is good, but if you brush too much, it's not a good thing. Because when you brush too much, your teeth actually gets worn down and your gums actually recede, and then expose a layer of your tooth that's often really sensitive.
Alright, and like after eating or drinking, our teeth's outer layer are temporarily softened from the acid in the food, and if we're brushing immediately after, it actually rubs the acid all over your teeth, and that breaks down the enamel and makes it a lot more sensitive. So it's actually recommended to brush at least 30 minutes after, or you just let your saliva naturally neutralize the acids in your mouth.
Or you can just rinse your mouth with water after that. Tooth sensitivity is temporary. Tooth sensitivity may come and go, but if left untreated, it can really get in the way of your everyday life.
Yeah, technically it should go away once the stimulus goes away. That's because our saliva has lots of calcium that protects the exposed areas. But if the stimulus is constant, like drinking on coffee, tea, constantly sipping on coffee and tea the whole day, then your saliva doesn't have the chance to form that protective layer, and the sensitivity may actually persist.
Brushing your teeth too hard can make your teeth more sensitive.
That is true. Like vigorous brushing or like using a very hard toothbrush, it can actually wear down the enamel of your teeth and damage your gums, which actually aggravates the tooth sensitivity.
So how do you know if you're brushing too hard? One really good way of actually knowing how is when you look at your bristles on your toothbrush, and if they're all like spiking in all different directions, you're probably brushing too hard.
Yeah, there's even like some pressure sensing electric toothbrush in the market, which are very helpful, because if you're applying too much pressure on your gums, it'll automatically tell you. Changing your toothpaste can make your teeth less sensitive.
So lessening tooth sensitivity may be as simple as just changing your toothpaste.
Yeah, in fact, like avoiding toothpaste that contain tartar control or whitening agents can actually help, because these toothpastes are generally a bit more abrasive and it actually causes sensitivity in some people. There are specially formulated desensitizing toothpaste if you have sensitive teeth, which decreases sensitivity.
Now these toothpastes are pretty special. They work by actually numbing or blocking off those pain signals from the tooth surface to the nerve. And so if you block those surfaces up, it makes it less sensitive and less painful for you.
Yeah, in fact, like a few of our patients, like if there's a certain brand or sensitive toothpaste, if it doesn't sit well with them, there's so many out there in the market, it's just finding the best one for you.
Tooth sensitivity can be a sign of a larger problem.
That's a fact. Tooth sensitivity can be a symptom of an underlying problem, like a cracked tooth, a cavity, an abscess, or even like uncontrolled gum disease. So if your tooth feels sensitive for a very prolonged period of time, it's really important to get it looked at so we can examine exactly what is causing the sensitivity. You can always ask your dentist to recommend suitable treatments to manage the sensitivity, and it's really important to get it looked at as early as possible to prevent further problems in the future.
Absolutely right, I think so. Using a mouth guard can make your teeth more sensitive.
That is not true. Like if you grind your teeth, wearing a mouthguard can actually help lessen the sensitivity, mainly because it protects your teeth from the effects of grinding, like wearing down of the enamel, right? So when your teeth chip or form cracks from the grinding, the stimulus that causes the sensitivity actually reaches the dentine, and this causes prolonged discomfort.
So really wearing a mouth guard really protects the dentine from getting exposed, hence decreasing sensitivity.
Hope your burning questions about sensitivity got answered in our video today.
Be sure to check out our website or visit us at Dental Designs Clinic.
Hope to see you soon!
Bye!